I'm Caitlin Walker.
I'm David Walker, and we have 2 kids, Mikey and Ellie, and Ellie was diagnosed with hip dysplasia.
The diagnosis happened pretty early on. It was one of those situations where Caitlin noticed something going on with like a click.
Literally about 30 minutes after she was born, and they gave her to me. I could hear the click. When we heard the click, it was right away that she saw a doctor, because as soon as I notified the nurse while I was holding her, and I could hear the click, I told the nurse in the delivery room. So she got the in-house pediatrician to come over to our room. The first pediatrician did not notice anything. Another pediatrician came up to the room, and then she checked out Ellie and confirmed that there was a click.
The only reason that we were really concerned about the click to begin with was because our son, he had the hip dysplasia, but not as severely.
After the in-house pediatrician looked at her, it had been about a day before she saw her primary pediatrician. And then from there, it was about 4 days until she saw the specialist at the Children's Hospital, which then they ultimately confirmed with the ultrasound. I wasn't really sure of the extent of what it was going to be since our son had a very mild case of that. He didn't need a harness or anything. Once I found out she needed to be in the harness, my perspective on the thing sort of changed a little bit. So she had to wear the harness for about 6 weeks. She had to wear that harness full-time, 24/7. Initially, we didn't put a shirt underneath her harness because they put some padding underneath the harness and told us that was going to be enough, that she would be fine. But it was really about 2 days after she had the harness where we started to notice the chafing and the redness. So we ended up putting a shirt underneath of her harness, which helped. Some of the benefits of the harness, though, were that she ended up fine. So after the 6 weeks, she didn't need to wear a brace. It's not affecting her long term. So even though it was 6 weeks, her first 6 weeks, which were tough, she doesn't have to worry about that anymore. So it definitely changed up a lot of routines. Bath time was very different.
Right.
Changing her diaper was a lot more complicated. So the big thing that was helpful, the doctor was able to show us the ultrasound and show us what the hip looked like. She showed us the normal hip, so the other side, which was normal for her, so the right side, and then showed us the left side, which was not normal. Being able to look at that and have her show us, well, here's what a normal one looks like on the ultrasound, and then here's what the abnormal one looks like on the ultrasound. That was very helpful.
She also mentioned what could happen if it went untreated. Their gait changes and it's very noticeable, and they can't do things like participate in sports as they get older. So at first there's no visible effect to it.
It would have been especially helpful if there was a pamphlet or some information on hip dysplasia itself. Mm-hmm. So if we had that to see exactly what the hip dysplasia is, how it affects her then and how it would affect her long term. All we had was verbal information from the doctor on that, but it would have been nice to go home with something. One of the things we weren't expecting was that she would end up with a flat head. It's a very common side effect of having the harness. And because of the harness, she was not able to move her head so much. Once she was old enough to start holding her head up and start sitting up on her own, her head really started to round out.
If I was to give advice to parents, really ask questions, because I think the most useful information we got was from the doctors. It wasn't really something that we were able to research on our own.
Putting it or wording it in a way that helps us understand why exactly they need this harness, as opposed to a situation in which they wouldn't need the harness.
Yeah.
There was also the option that Ellie would have to stay in that harness longer than the 6 weeks or move into a brace following the harness. And I was just constantly anxious because that wasn't communicated well enough, that this is what we need to see in order for the harness to come off. This is what we would see if that meant we needed a brace. Mm-hmm. Just kind of outlining it so that way explicitly we knew process, the steps, and all of that, just to put our minds at ease. So some of the positive surprises that we had through this experience, one, she did not seem affected at all when the harness was being put on her.
Yeah.
We were definitely affected way more than she was.
Yeah, it was emotional.
And then even through the rashes and the chafing, she did not cry. She never seemed upset. She was never tugging at the harness. It was just like a normal piece of clothing for her. which made it a little bit easier on us. But one of the best things was when that harness came off, she started smiling immediately and pretty much hasn't stopped.
Yeah.
She's one of the happiest babies I know. She's not behind in anything in terms of her development and mobility. Knowing somebody who maybe at that time either was going through it or had just gone through it, and to show us that light at the end of the tunnel.
Yeah.
And Ellie acts as though she never had a harness. It's not a part of her life anymore. She's perfectly fine. She's a very happy baby.
She smiles at everybody.